table 5 and we're doing the heart and pericardial sac. This is the outside of the pericardial sac, which is the fibrous pericardium. On the inside, immediately continuous with the fibrous pericardium is the parietal pericardium here and here. And on the heart wall is the visceral pericardium. This is the right atrium and right auricle. This is the right ventricle. This is the left atrium and the left auricle and the left ventricle. As far as vessels go, we have the aorta, the superior vena cava and inferior vena cava, and the pulmonary trunk. Can you pause it?
No. Pulmonary veins.
We're not doing
the sinuses, remember?
Oh yeah. There is a transverse pericardial sinus, which is where you put your two fingers behind the pulmonary trunk and aorta and in between the superior vena cava, and this is where they clamp off in cardiac surgery to place coronary bypass. There's also the oblique pericardial sinus, which is where you put your fingers underneath the posterior aspect of the heart, and that stops when you reach the 4 pulmonary veins. Off of the aorta, there is the right coronary artery, which has a branch to the sinoatrial node, which we can't see here, and that runs down the right atrioventricular sulcus, and also has a branch which is the right marginal artery. On the left side, coming off of the aorta, is the left coronary artery that runs in the left atrioventricular sulcus. That also branches into the left anterior descending here and around the back to the circumflex in the atrioventricular sulcus.
So, moving posteriorly from the heart, we can see the 4 pulmonary veins here. They have clots in them, so pretty easy to distinguish here. The inferior vena cava is right here, and under the veins we have the coronary sinus, which is where all of the venous return of the heart pools into, and then it dumps into the right atrium. We have the right coronary artery here that branches down and becomes the posterior something. The right coronary artery branches over here and becomes the... Still don't remember. That's a vein. No. All right. So, the right coronary artery branches this way and becomes the posterior descending artery. Interventricular, you could call it, artery. Back a little bit to the anterior side, the left becomes the circumflex artery. The circumflex artery wraps around a little bit posteriorly as well. The coronary sinus is fed directly into by the great cardiac vein, which also goes anteriorly and follows the left anterior descending artery in the interventricular sulcus. Other veins in the posterior aspect, we have the small cardiac vein would follow the right coronary artery. The middle cardiac vein here follows the anterior posterior interventricular artery. I think that's it. Oh, and we couldn't dissect it, but from the sinus up into the posterior aspect of the 4 veins would be the oblique vein, cardiac vein.
Okay, so this is our second heart, and so this is how it sits in your mediastinum. It's a little bit diagonal, if you will, so it doesn't sit this way. It sits this way. This is the anterior side, and this is, sorry. This is the apex of the heart, so that would be the most interior aspect of the heart. So right here, the most interior great vessel would be the pulmonary trunk, Here you have the aorta, and then from there I am going to open in a minute. This would be the right atrium. So emptying into the right atrium, you have the superior vena cava and inferior vena cava. They got a little bit destroyed in the process. And then here you have a really pronounced coronary artery sinus, coronary sinus where the veins are emptying into, So this is where all of the venous return that was directly giving blood to the heart is going to come through. So here, this would be the pectinate muscles of the right auricle, and then separating the pectinate muscles from the smooth muscular wall of the rest of the right atrium is the crista terminalis. And that's just this kind of pronounced muscular ridge right there. So then following that, this would be the right atrioventricular valve, and this is a tricuspid valve, so you can see 3 small valves in there. And so blood is going to come from the superior vena cava and inferior vena cava, as well as the coronary sinus, and come into the right atrium. From the right atrium, it's going to flow into this tricuspid AV valve, atrioventricular valve, and come into the right ventricle. Can you see that at all? Okay. So here we have...
I'm gonna hold it open, you can point.
That would be great. So here we have the right ventricle. So these are the chordae tendineae, and this is the papillary muscle. Sorry, can you see that? Okay, so the chordae tendineae, their job is, as the right ventricle is filling with blood from the right atrium and the pressure is building, they're going to hold this tricuspid valve shut, and that allows the pressure to build in the right ventricle enough to kind of blast through the semilunar valve, also called the pulmonary valve of the pulmonary trunk. These are the papillary muscles which anchor these chordae tendineae. And then here you can see a little bit of the carinae trabeculae, which we will see a much better view of in the left ventricle. Did I miss anything?
Fossa ovale.
Oh, oops, sorry. Sorry, going back to the right atrium, I missed something. So right here, this little buttonish piece of tissue, that's your fossa ovalis. So that is the remnant of the foramen ovale, and that is a developmental piece. So it happens when you're an infant is that the foramen ovale is there to merge with the vena cava, and that allows blood flow between the atria, because you don't really need the right ventricle to pump up blood to your lungs because you're not really using your lungs. And when you're an adult, or when you're an infant and you take your first breath, this valve shuts and will eventually merge together to become the fossa ovalis. So it's a very thin piece of tissue.
You can see it's more pronounced in this other heart.
Right there. Okay, sorry about that, little aside. So then, finishing up in the right ventricle, you're just gonna blast through once this ventricle fills with blood, and you're gonna blast through the pulmonary semilunar valve and go through the pulmonary arteries into the lungs.
Okay, and then, so the last part overlaps a lot with the right side of the heart. It's a lot of the same structures. But once the blood is pumped through the pulmonary trunk and out the pulmonary arteries, it goes to the lungs and it's oxygenated, and then it comes back via the pulmonary veins. So you can see the 4 veins here, they're kind of shredded, but they're right here, and they feed into the left atrium. So, let's see. Okay. Okay, so the way you see the left atrium is through the pulmonary veins. So this is the left atrium. You can see the smooth wall, and then the auricle is harder to see on this one. Is it easy on that one?
We didn't dissect it on this one. The auricle's right here.
So it's like kind of that, it's the little flap that comes off. It's harder to see. But yeah, if you look on this one, it's this flap right here that comes off of the left atrium. And then when the atrium contracts, it goes through this valve right here that you can see. This is the top of the valve. This is a bicuspid valve, also called the mitral valve. And it goes through that into the left ventricle. So this one's really hard to open because the muscle wall is so thick. So it's about 3 to 4 times, is it 3 to 4? Times bigger than the wall of the right ventricle, because it pumps blood to the whole systemic circuit instead of just to the lungs. But so when you look in here, it has the same structures. Okay, it has the same structures as the right ventricle, so you can see, it's so hard to open, but you can see the chordae tendineae up in the top there. So they're doing the same thing as the right ventricle, where they hold the valves shut, so both cusps of the valve shut, and prevent them from inverting into the atrium when the chamber fills with blood. They also have the papillary muscles that hold down the chordae tendineae to the muscle wall. And then on the side, down here, you can see these sort of rough walls. So that's the carnae trabeculae, and that's also in the right ventricle, but it's harder to see there. But those are just projections of the muscular wall. Then, when this pumps, it goes into the aorta, and it goes through the semilunar valve, or aortic valve. It's kind of hard to see. You kind of just have to shove your finger up there, but then it comes out through the aorta, and I'm stuck. And on the other side of the valves, so the semilunar cusps, there are sinuses, and they prevent the cusps from sticking to the side of the artery. And then right at those sinuses, there are 2 branches, so that they branch off to the right and left coronary arteries. So you can see that best in this heart. Yeah, so you can see here, so these are the semilunar cusps, so these are what fill with blood and shut the valve. And then this one has a pretty good coronary, right and left coronary artery, right?
Yes. Left.
So one of the sides, so.
This is the aorta. So the entrances to the left and right are in the aorta itself. And it's hard to see, but you can see the probe I stuck in the aorta, and it's coming out of the left coronary artery.
So that's the first branching that happens to the aorta before the aortic arch branches into the 3 vessels. And that, and then the clinical implication. So the, did you do your clinical?
No, I think
okay.
I have to do.
The clinical implication. So the aortic valve. So like Alex was showing. Did you use the pulmonary?
Use the pulmonary one.
Okay, well, so this is, so you can see the cusps here, how they fill with blood, and that's how they shut. And there are 3 cusps in both the pulmonary and the aortic valve. And one disorder that can happen in the heart is you can have a bicuspid aortic valve, which is when 2 of the semilunar cusps fuse together. And that just sort of creates a leaky valve. I believe that it's around 6% of blood sort of leaks back because it's not closing very well, and most people who have this disorder need to get a valve transplant by the time they're 40. Arnold Schwarzenegger has this disorder.
One other quick clinical consideration is just atherosclerosis, which is basically an umbrella head for just an umbrella head term for your disease filling up your arteries filling up with plaque. a yellowish plaque that just develops from just bad habits. And what can happen in coronary artery disease, which is a form of atherosclerosis, and a #1 killer or a major killer of males and females, is that your arteries of the heart fill with plaque and the blood flow is really constricted. So it's just our last clinical consideration. And we're done now.